I am a professor in the Paul G. Allen School for Global Animal Health, and I'm also executive director in the Washington Animal Disease Diagnostic Lab. We call it WADL.
The mission of the Allen School is to understand the connection between animal and human health. And based on that understanding and that knowledge, to develop strategies that will improve human health and economy.
And it was started by a donation from Paul G. Allen and the Gates Foundation. It was a privately funded facility, and the focus was zoonotic diseases, so studying diseases that infect both animals and people, and trying to make better lives for people in resource-challenged countries where they have to deal with these diseases all the time. As an animal health testing lab, we have a high throughput capacity. We can test a lot of samples in a short amount of time because we're dealing with herds of animals, not just single people, so to speak. So we had some capacity we could give to the state. So we contacted them in March and asked them if, did they need our help with some of the human testing for COVID-19. And at that time they said, no, I think we got it covered. And then about a month later, they called us back and said, we need your help.
This is a primary example of sort of why we do what we do. This whole idea of how does suddenly a virus go from affecting a small animal population to then jumping species and then being able to infect humans.
WADL as a lab has multiple lab sections for different disciplines like virology and pathology and parasitology and that kind of thing. And we test about 300,000 samples a year, and we had to keep that testing separate from the human health testing. And we had to maintain the capacity on the animal health testing for emergencies that might come up, like bird flu or African swine fever from China, or we couldn't stop doing that. When it comes to a swab and testing for an infectious agent, a human sample is the same as an animal sample. You got all the same issues. So that transition was actually quite easy. We had to hire 7 new people, and we then managed them with the folks we have. So we stood up a new section basically for the PCR testing, and then also for the antibody testing for COVID-19 in humans. We get samples from Insight that they have collected. They have different entities that they deal with. It could be WSU, it could be Gonzaga University, it could be Pullman Regional Hospital, it could be another hospital or clinic in the Spokane area. The whole of Eastern Washington we're getting samples from. So they send us those samples and they electronically transfer the patient information. We tie that all together in the lab, test the samples, send an electronic report back to Insight. They send it to the physician who ordered the test. Between Insight and WADL is a perfect partnering because WADL provides that high throughput capacity at the lab levels, collecting samples, collecting patient data, actually testing the samples, and then sending the reports back to the physicians and dealing with departments of health where they monitor the level of infectivity in a population of people. So Insight did the ends, so they collect the samples and they deal with the patient data and they send the reports at the end, and they bill with entities like Medicare and Medicaid and insurance companies and stuff that WADL doesn't do, and we handle the testing in the middle. So that's that partnering that works really, really well to do that, and Insight's been a very good partner for that. Right now we're testing about 600 to 800 samples per day. We get samples in the morning and we're reporting out by that afternoon, so it's about 6 to 8 hours. The turnaround time for the patient, though, is longer because you sample the test, they got to get the samples to us, you report it out at the end. The combined partner turnaround time is generally 24 to 48 hours.
It feels like the progression of information that we're getting about SARS-CoV-2, it feels slow because we're in the middle of this pandemic, but it's probably unprecedented, the speed at which we're learning more and more about the virus, more about how people can be protected, how it's being transmitted. Early on in the pandemic, you just kept hearing different bits of information because people were really starved to sort of understand it. We know about mutation rate. We know about what are the receptors on the host cells. We know about are people developing an immune response to it? Do people develop antibodies to it? Going through this now at the level of knowledge that we have now and the technology we have now, it will happen again. And I think we'll be even better positioned to react even more quickly to this kind of an outbreak. One of the things that has become acutely clear is, again, that connection between animals and humans.
Animals get diseases, people get diseases, the environment gets contaminated with the same agents. How does all this interconnected and how does this work?
What I like about this connection with Waddle, we can take those results and use that to understand what are important questions or what are important emphases that we should be taking right now, and actually not just recognizing an outbreak, but how then can we strategize to control that outbreak and to prevent it from happening again in the future.